Okay, hello everyone. My name is Eze Victor and is the aka Elastic Heart, aka Boo of the Bullets. I'm in final year dentistry and dental surgery, University of Nigeria.
Hello everyone, my name is Onugwe Joyce Chisom. I'm a final year student in the Department of Dentistry and Dental Surgery at the University of Nigeria.
You would have thought he was a pastor, well, not like very, very churchy, but like
these are the etiquette that I was able to put down. Don't worry, this video will not be.
Everyone, you're welcome back to my channel. It's Talk with Ogo here with you on this channel. Wow, it's been a while. I went on a break. I know that, man. It's not easy being a YouTuber, but we move. So anyways, you guys, I can see special guests on my channel. You can see them. So on today's video, I'm going to talking about how to pass medicine and surgery. Okay, why I decided to talk about this topic actually is because when they wrote the exam, the tension was too much. Like, it was too much. And then the people that failed, that have never failed before, failed the exam. People that have never thought of, like, and it was intense. And I'm like, oh, I'm scared. I'm like, okay, I think this guy can help and give us maybe the things that they think is went wrong. Do you understand? Like, that could cause why this happened, and how in the midst of the things that were causing the happenings, they were able to scale through. You get? So that's why this video is being made. I'm going to learn from them, because even me too, I never write the exam. I'm a 500 level medical student. They're in their final year. They senior me now by default. So I'm here to write my first MBS exam. So I'm here to learn. I write mine on my final year. So you guys stay tuned. Make sure you listen. Get your notes, your pen, and write down important points they're gonna point out here. And so another thing I also wanted to say is, please, you guys, try to please comment and like give it like subscribe to I forgot to say that. Subscribe to my channel. Very important. Like and comment and smash that post notification bell to get notified whenever I get to post. And please, you guys, there's one thing I always want to beg you guys. Please, you guys should comment, say something nice. Like, it makes me happy, it makes me to want to do better and do, like, when I get to see a lot of views and little comments, it doesn't really encourage me. So please, you guys, show some love to your girl. Like, encourage me if you can. Don't just watch the video and just pass. Okay, anyways, let's go straight into the video. Okay, so you guys, I'm going to be handing them the mic to enlighten us. So first of all, I would want them to introduce themselves, where they're from. Of course, they've said their level, and if they want to say it again, they can just do freestyle, just do you, man. So, Rejoice.
As I earlier said, my name is Onugwe Joyce Chisom. I'm a final year student in dentistry and dental surgery. What else? From Anambra State.
My sister.
Yeah.
Okay, my name is Eze Victor and is, like I said earlier, in final year Faculty of Dentistry, University of Nigeria, from Ngo, the home of CCO. No, you already know, the home of Bianca Ojukwu.
You really have to say.
Okay, yeah, that should be all for now.
Okay. Anyways, okay, thank you so much, so guys. The second question I'll be asking them is, what level do you do medicine and surgery exam? For those that don't know, or you are not into medicine, or you don't know anything about medicine, or it's your first time hearing about medicine or anything sharp, but what level do you do this medicine and surgery exam that we're about to now to pass?
Okay, basically we write medicine and surgery exam in our 500 level.
You have anything to say?
No,
all right, yeah, 500 level medicine and surgery for dentistry. Then for medicine, I think ours is it's final year. We write it as a final year BS. Okay, so the third question I would ask them is, what materials did you guys use to enable you pass your medicine and surgery exam? Yep.
Okay, basically for medicine, I think I read most of my materials, if not all. I tried as much as possible to cover M1 to M4, in as much as I did not read up to M4, but I made sure to touch a little bit of all of them. Then I don't know, but Davidson helped just a little bit. Then I think basically that's for medicine. Okay, and then the clinical methods, Hutchinson's and the rest of them really helped too. Then for surgery, the use of textbooks cannot be overemphasized. Like, you have to read your textbooks and read it again and again, because sometimes the materials are very, very scanty. You just open one material and it's like maybe 4 leaflets, and you're just seeing points, and you're wondering what is this point here. And then if you don't even attend the lecture, you won't even know what the lecturer is saying. So you're just looking and gazing at the point. So the textbooks are very, very important, Bedo and the rest of them. So I think basically.
Okay.
Okay, essentially, I think the preparation of medicine and surgery exam, unlike every other exam you've written in medical school, it's not like second MB, it's not like third MB that you just have to read materials and go and pass. That's why many people don't pass medicine and surgery, because they think that it's something they start preparing for when the timetable is out. Medicine and surgery is the type of exam that you start preparing for from the first day of M1 postings, because like I always tell people that a professional exam begins not with the main exam, begins with all the assessments you've done, like M1. So we first started the journey of medicine and surgery began in 2019 when we wrote our M1 test. Like, it was a shock to everyone, like our first exposure to clinical examinations, how you come, click a patient, present, and you get your points. So some of us made some mistakes there, but that was basically not all about reading. Like, you have to come around. That's the number one reading, coming around, because when you're talking in an oral exam, if you don't come around, they will know it's very obvious you don't come around. So it begins with coming for postings, and the preparation begins when you're doing a particular posting, because medicine, there are so many specialties in medicine, and you'll be examining based on these specialties. And it's when you're doing the postings, unfortunately, you don't get to do all the postings, right? Whether in medicine or dentistry, you don't get to do all the postings. So anyone you're doing at any particular point in time, make sure you get oriented with all this stuff in the undergraduate curriculum of the exam. Let's say you're doing endocrinology, for example. You should know that diabetes mellitus should be your friend, maybe thyroid disorders or the hormonal disorders. So now, when the exam is coming close, obviously you have to read. You have to read your materials. Even though the MCQs in medicine, nothing much from materials will come in. I think basically coming around is 50% of the reading. Then of course during the exam you have to really
clinical postings, but like you have to
exactly you have to be coming around. Yeah, you have to write, because most times, like when I looked at my jotter, what I jotted in 2019, even though that it was my handwriting and in my jotter, I wouldn't have known that. I'd be like, I've never heard this thing in my life, guy.
I relate actually.
So yeah, you have to come around. You have to write down some things. I have to look at them. I have to ask questions, be involved in patient management, because when you are writing the exam, it's like you are the doctor. You'll be like, patient comes with this and that. What do you think is the diagnosis? What are the differentials? How you manage the patient? It's not about reading. If you have to come around. For example, someone that just reads will just be like, okay, the drug is penicillin. Maybe someone just know that there's a drug called penicillin. If you come around, it'll be like, okay, you give penicillin, IV penicillin, maybe penicillin G. Yeah, that's one IV penicillin G with 400 international units start. If you are talking, like, your essay will be to stand out from someone that just reads books and all of that. So I think it's just a hybrid of reading and coming around. And then the materials, Davidson, like she already said, then Hutchinson's is a clinical methods textbook, can never be tossed away. And then of course there are also some other summaries like CMDA guides. There's some other all those small books. They are very important passages. So that's about
when did you start reading the summary? Was it like close to the exam period?
Okay, like the name implies a summary. You can't summarize what you haven't gone through. So during the exam you have to look at summaries. Even though I didn't get to look at a lot of them, but those that looked at them, like when we come out, they'll be like, I saw this in CMDA stuff, and then be like, they say this in our posting. They need to say anything for my own posting. I swear.
No, I don't know why, but most times I feel like they say it, but girls catch it faster. Because most times, yes, you see two persons, and then a lady and a guy, and then the girl is saying, "Oh, my consultant said this thing in so and so posting, during maybe M1 posting or M2 posting," and then this other guy is like, "No," when they say, and then the girl is bringing out her notes and look at it, and then the guy will be like,
so I was in this posting.
Maybe we have to carry it out in study. Maybe there's something about deafness that goes into Y chromosome, because so that's basically it.
Okay, so okay. What about, like you said about Hutchinson, reading textbooks? So that means the materials didn't really help in medicine and surgery. Is that what you're trying to say?
Yes, because let's just say they don't consult these materials. If you look at the question, you see that they didn't consult materials when setting these questions. Do you understand? Like, I can never beat my chest and say that any particular MCQ question came from the materials.
Are you serious? Is it both medicine and surgery?
Both medicine and surgery.
I think I beg to differ.
Where in surgery?
In medicine, some of the questions came from the
materials.
I'm better with my materials. I print most of my materials and I write on them.
You
and
mean
then
most or some?
Like, say,
I'm saying 50 questions.
50% of the questions. Yes, they are from materials. Then some of them from the textbooks, and then this thing, what's it called? Postings and all of that. But then they're from the materials. If you at least
actually, you're not talking about M2, you're talking about medicine and surgery main.
I'm talking in general, medicine in general.
I mean, okay, well, maybe you're talking about the test.
I think it's because you didn't really read material. That's why you don't really know that the answers were actually there.
Oh.
That's
Mm.
because that's why.
Then
And you're more of a,
materials.
maybe you're more of a textbook person, right? Am I right?
Yeah,
I think that's
I look at my materials though, but like
Not
I
as
think, I don't
much.
binge on materials. I look at them, so I won't blame myself. So when
I
people like
read
that start saying it's from the
I read
materials,
materials and then I go to textbook. For what I don't understand, I go to textbook to try
Okay.
to elaborate and see, okay, what am I missing? Because
Okay.
sincerely speaking, I love sleeping. So
So wait, okay, so wait, you mean that's surgery? Wait, are you saying both surgery and medicine?
no,
should read material?
surgery was mean. At least surgery main was really mean. Those questions were synthesized.
Like it was not a textbook or what?
No, like
They
okay, something about the MCQs. Even if you have your phone, if you're opportunity to have your phone in the hall and you're browsing the answers, you still feel if you don't know what you're writing, because the questions are not like they don't have a direct answer. Do you understand?
You have to think them
You
out.
have to really think.
And then
like,
even when you're thinking them out, if you think, can't fail the guy.
they won't ask you direct questions, not like pathology. Do you understand?
Yeah,
That's
yeah.
why you won't remember a lot of the questions, because when you came out trying to remember, you can't really remember because these are not
Exactly.
like direct questions.
Yes.
So that's.
So I remember that question we were talking about what you don't give for examination. No, sorry, investigation you don't do for someone with, I think is it something about the heart, and then some people were saying this thing SEUCR. Some people were saying.
Okay.
You remember that question
Yeah,
now? So everybody was confused.
Yeah,
Even the
exactly.
textbook
So,
was not giving a straight
yeah.
answer. Yes.
So the only person that knows the answer is the examiner.
The examiner, the person who said it.
Yes, but some of the options you can argue it out. Assuming it's a conversation, you can justify your options.
Yeah.
But because you don't know what is programmed as the
Yes,
answer, so it all depends on the examiner. You can have more than 2 answers that are correct.
Yes,
for
that's
them.
why they say it's like best option.
Exactly. So,
So this one is correct. This is
best
correct.
option
But
is
then
dependent on the examiner.
but then this one is the most correct.
Wow.
Yes.
Wow. So, I don't even know what to say again. I'm confused now. So, are you trying to say I should do me? I should just read anything I feel like me. I should read material. I should read
Okay,
textbook,
I think the summary of the point is that every single thing is important. Like pick up things. Like for someone like me, I come around a lot. Like I pick up things from postings. I also read my textbooks a lot. I also read materials. I come to class. All these things they say they should do, I do because I don't want to blame myself at the end.
Yes.
So the highlight of it all is that, like I said, fundamentally you have to come around. You have to come for
Okay.
postings because it's what if you notice, if you're doing a posting, there's a question they always keep asking and asking and asking.
Yeah.
That lends importance to that
Okay,
question. Do you understand?
okay.
You can always be like, anytime you come, they can be like, okay, tell me if it's in neurosurgery, for example, they can be like, tell me the ABCD of congenital hydrocephalus, for example. Every senior registrar always
Yes,
ask you
you
that
always see that
question. Do you
question.
understand? That is
Okay.
something you need to
To
know.
know.
You don't come around. Someone can just go and read hydrocephalus. They will not give attention to that ABCD
Particular
stuff. So you
ABCD,
need to
yeah.
come
And then you
around.
might just know them, but you not know that they are called A, B, C.
Yeah,
exactly.
So because even the first time I was asked, I was just naming them. I was like, no, it has a pattern. I'm like, okay, what is the pattern? He then said A, B, C, D. I said, oh, so that's the pattern.
Okay.
So you have to come around. The classes and like can never be overemphasized.
Oh,
Can never ever be overemphasized. Because I know my class notes saved me a lot of times. Times when I'm just tired. I don't want to open my notebooks, my jotters. I don't want to open anything. I just open my notebooks on my bed and I'm just looking at it. And somehow it helps.
Okay.
Always helps. And then you just hear there's some lecturers who just help you remember things. But just be saying one thing and be like, oh, upper GI bleeding is from so place, so place, and then you just remember, oh yes, this woman said something like this, and you see it in the option and you take it because we're in the class.
Because we're in the class.
Yes.
Ma? Okay. And wait, and this class is talking about the one that I said that. Do you still remember the ones that they thought of that M1, M2? Do you still remember
This is
those?
where class notes
That's
come
why
in.
class notes
come in,
yes,
come in.
because
Example,
you have
you're
to
not
go
like,
through the
oh.
notes
Yeah,
and then be
yeah.
like, oh, because there was even this topic I didn't even know what I thought. It was just that I opened my notes
So
and I
then you
saw it,
saw
I was
it
like,
there,
what is this?
Okay.
Yeah, it's very
Okay.
important.
All right. Thank you very much for these answers. I'm really okay. So you guys, the first question I would ask is, what were the challenges you faced while studying for this particular exam?
Okay, for me, yeah, it's subjective. Like for me, I will say the ones I face. Like she'll have her own. Okay, so for me, I think the problem is that in dentistry, because you're writing the exam in 50, we don't get to do all the postings, right? So
Yeah.
in medicine, like in medicine, internal medicine, we do M1 and M2, right? And then that's 1 unit. You should do M1, 1 unit. So like for me, for example, I did nephrology in M1, and then I did endocrinology in M2. All right.
Okay.
Even though when you're doing a particular medicine post, you may pick up something from other units, but it's not as deep as someone that did cardiology, for example. I never did cardiology, right? And the mainstay of questions in medicine is always cardiology and respiratory. So I did nephrology, and they don't really ask dental students a lot of things in nephrology. So I didn't do endo is a high yield place, but it's not as high yield as cardio and respiratory, right? So my number one challenge is that we don't get to do all the postings, and they won't factor this in when it's sitting the exam. Everybody will be on the same pedestal, so you have to cover for the ones you did not do. So one of the things I did is to look at the study materials of those that did the postings and look at the high yield things they asked them, and now put myself at par. And also shared my materials for those of them that didn't do the ones I did. So that's for medicine. And then the short postings too, we just did dermatology and psychiatry, but they didn't feature much in the mid exam, right? So number one challenge is that you don't get to do all the postings and have to read everything. And the second one is that you can't hold on to like a particular topic and be like, this one must come out. So you have to read a lot of things, and at the end of the day, lots of things will come out. Like just a few things will come out from a lot of things you've read. So you don't know like which one to do. Like in medicine, I think internal medicine has like 8 specialties, and then the short postings we do dermatology and psychiatry, making it 10. So you have to read across 10 specialties. At the end of the day, maybe the one you gave in your time that will not come out, and now the one that you just glanced through will not come out. Like they asked us something about GERD in the essay. Can you remember a question about GERD? I read it the night before, and then I was flowing. But then they asked us something about what was that stuff?
CKD.
CKD, right? They
I
asked us
read
question about
CKD
CKD, and I did not read it. You understand? So that's the challenge. And then another thing is that you don't know how much percentage is allocated to each particular assessment. So you don't even know which one you are giving your best. You don't know whether it's M1, you don't know whether it's M2, you don't know whether it's the short posting, you don't know whether it's everything. I don't know whether the OSCE and OSPI will stand out on their own and be their own 100%, and so you just don't know how they combine the scores. So you don't know what to give attention. But then obviously, if you fail clinicals, you fail the exam. Like once you see FC, simply means to tell you that you fail clinicals, but you're actually resitting the entire exam. So that was not knowing what to read, and now having lots of things to read and not knowing where they will ask from. Because even if they give you AOC is still scam. Like most times they give AOC, it definitely doesn't come out. Like all the revisions we did, they just wasted my time. All the AOC they giving.
No, I think one revision paid out.
Gastroenterology, GERD,
No, she just mentioned it in passing. I was like, oh wow.
She said it's very important to us in
but
dentistry.
it won't come out since we're not taught. Oh wow.
She emphasized on hepatitis. Did you see any hepatitis question?
But then there was no hepatitis question. But
what?
No, cardiology. The hypertension. She really took her time.
Did hypertension even come out?
Yes, it did.
God, that big.
It did. So it was like she took her time to explain. I said, okay, if I ask you this question, this is how you should give it back to me. This is how it should go. Go this way, go that way. If I now tell you management, you start stepwise. First, admit the patient. I can remember she said it.
Okay, how about neurology?
No, neurology. Neurology was terrible. That was just.
How about respiratory?
No, respiratory was good.
In theory, respiratory did not even come out.
What you say?
Respiratory in theory.
Yes, now was that
what
not where
question?
we had what was it called? What's the name of that?
Okay, asthma. Status asthmatic.
Yes,
well,
acute severe asthma. Yes,
Did
came out.
Yeah, they tried, but then
Came out.
AOC, anytime they give you AOC, you have to take it with a pinch of salt.
Pinch of it might come out. Basically, I think my number one challenge was having too much to read and not knowing where to start from. So most times I just get frustrated and I'll be like, oh God, what's all this nonsense? And boom, I've gone to bed. That is like I think that's like one big challenge, like having too much to read and not knowing where to start from. And just like he said, the whole thing about us having to do M1, M2, and then we have questions from M3 and M4. It's just too bad. It was just terrible because at some point I heard about the M3 M4 thing quite late. So when I was supposed to be revising, I was now trying to look into some topics in M3 and M4, and it was terrible. I'm telling you, at some point I just left it. I was like, I beg, whatever happens, let it happen. I was just so tired. And then my other challenge was sleep. See, sleep is necessary, but I just felt like I was sleeping too much during the afternoon. I have to take afternoon nap. Sleep is necessary, let's be sincere, but then at some point it becomes too much and you start telling yourself the truth. It be like, say I go fail. Because I remember during short posting tests, so we're having back to back. There was one day I came back, I was like, now what is all this? Me and my roommates were doing sleep small, I'll wake you up, I'll now go to bed. That's how we kept doing until both of us just slept off. And then woke up the next morning, we were tense. And then we got to the school. It was a nonsense exam. They gave to us. It was not.
My own is WhatsApp.
No,
I can't breathe without WhatsApp. Guy.
Like
I always
sleep
come
was
and
like a
start
major
feeling-
problem.
See you whenever you I'm like, "Oh, you write exam. You write an exam. and
Sleep
all."
was a major problem. Sleep was also a major problem. And then another thing was the fact that they, I don't know, make us believe that we are dental students, so we don't need so many of these things. And then you go to the exam hall and you
They
see it. Like
bombard
you meet someone telling them to explain something to you, or they're asking, let's say in our normal general M1, M2 postings, and then they're asking general questions. And you're now like, oh please, what are they saying? And you say, oh, are you a dental? Oh, there's no need, you don't need it. But then you come to the exam hall and you.
But it's funny how these things don't happen in my it doesn't ever happen in my postings. Like I've never seen anybody hold back stuff from me because I'm a dental student.
No, it has happened. A lot of persons has complained about it. I know that happened to like my very before once, but that was like during, I think, neurosurgery. I was even short posting set. But then during other short postings it didn't happen. But so many other persons complained, especially in radiology, when the residents came back and then they were doing the ultrasound during ultrasound, and they will be
and that's how radiology exam
and then radiology, this thing was now back to back. You were now seeing endometriosis, this one, that one, and you're now like, what is all this? I thought we said we didn't need it. It's like some persons, like I was like peeping and looking. They thought us though because it was during
ultrasound.
yes, it was during
residents were on strike.
yes, residents were on strike that period. So consultants taught us. So we're lucky. But people that came like much later when the strike was over, man, those people saw man. they really really suffered. But then surgery was cool, Sha.
Yeah, I think surgery
was
we are
cool.
just talking about medicine and not really talking about
Yes, but surgery was cool. Just basically read textbooks. I didn't really have too many issues with surgery. Yes, failure was more in
only 7 failed
surgery.
Oh,
failure
but-
was more in medicine.
wow.
And
Yes.
in such a way that everybody that failed
Medicine also failed surgery.
Sorry, everybody
Everybody
that failed surgery
also failed medicine.
To tell you that it's easy to just pass surgery.
surgery,
By the time
yes.
you fail surgery, you need to have failed medicine since.
Yes,
Yeah,
basically.
Yeah,
That's true.
Okay. So the fifth question I would ask you guys is, what were the things you wish you did and the things you wish you didn't do while studying or writing the exam? Who's going first?
Okay, let me go first.
Okay.
Okay, the question begins with things I wished I did, right? Okay, I wish I started practicing early, like for the clinicals, the physical examination, because I found myself really tensed.
Okay, physical examination.
Yes, in OSCE and OSPI. OSPI is the objectively structured clinical exam where they set
That
stages.
OSCE and OSPI, is it both in medicine and surgery?
Yes, you
Yeah,
write
both
OSCE and
medicine
OSPI in
and
both. So OSPI is just picture show, is objectively structured pictorial exam,
Okay. Yeah.
and then OSCE is objectively structured and clinical exam.
Okay.
So you need to have practiced a lot for you to be able to do it confidently, especially in medicine, because in surgery we didn't get to do a lot of things, just like steeplechase, like a regular steeplechase in surgery. But in medicine you have to do some examinations. So I found out that normal me, like I know it's a sin for a medical student, but I don't like touching patients in the hospital. If I didn't post and be like, someone should come and check this patient's pulse, it can never be me. I will not come. And they be like, go to the ward and examine the patient's abdomen. I will not go, but I will watch other people that will take the corrections. But they not practice on my own, and it's a lot. Like practicing on your own, nothing can replace that. Even if you like listen, take videos, everything. Once you don't practice, and then they say you have to practice on your roommate. I don't know how. I think it's gay coming to practice. I don't know. You know, girls do some gay ass shit for boys. I don't know how I'll be opening my roommate's chest and be examining his chest. So that's not wasn't for me.
It's
Yeah.
very difficult for the guys.
Yeah, so I didn't practice a lot, so I found myself missing some things. Like if you tell me to explain how to do examination, I'm very good. I can explain. I can rattle it down. But if you tell me to go and perform it, like when I did general exam in one of the stations in medicine, I just did to check for lymph adenopathy. I just did axillary. I did not remember to do check the other lymph nodes because I had not practiced a lot of times. I just know the theory, but I've never really performed it. So I think I wished I had practiced more. You should have given me an edge. Even when I checked when they told us to check the lower limb reflexes of a particular patient,
Yes.
I don't even remember to raise the limb. Like I was just so clumsy, right? And because I've not really practiced a lot of times, so I think one of the things I wish I did was in the clinicals. I read a lot for the theories, but I wish I did a lot more of practice.
as well.
Yeah. And the things I wish I did not do. Well, I wish I did not read every single thing that did not later come out. I wish I did not read dermatology. Nothing came out from dermat. I was practicing atopic dermatitis, all of these things. So every single thing, I wish God would just open my eyes to things that will come out. So that's the highlights of mine.
Okay, so Rejoice.
All right. The things I wish I did. Okay, I think I wish I paid more attention to OSPI. I don't think I opened OSPI to like the week of I was like, no be OSPI. hospital, we'll do it. How many slides will they ever bring out? 10, 15. And I said, guy, I'll find a way around it. I kept telling myself, I kept pushing it, and I started getting choked up, and they then just dumped this bomb. Like, we had on Tuesday was medicine main, Thursday was surgery main, and then we came back late, that surgery main, and the next day on Friday was medicine hospital. I was running mad. Like, this is what I was doing when I sleep small. I wake up, I look around, and I like, the sleep was just not leaving my eyes because I was so tired that day. I think we all came back late. Yes, because we finished late, so I was so tired. I really wish I went through the OSPI early enough. I don't think I had too many issues with the OSPI as being the OSCE, sorry, as per the physical examination. But then some of those questions were really, really weird. Some of them, yes, like some of them like that are not like basically like attending to a patient. We just ask you a question. Some of them were weird. Some of them I didn't even know what they were talking about.
I preferred those ones, right?
No, I actually preferred the examinations. I think I was quite good with it because I had already yes, because I had practiced so much on patients, yes, and then on my roommates, and then anybody that was willing to present himself out, I would just examine, because I was thinking that we were going to have like a lot of examinations or clinical stuff, but then they then came and started asking us questions. So,
and I also think that most times examination, they just tell us to examine with male patients, making it difficult to actually examine female patients. For us, the males, I've never touched a female patient in my life. Okay. And the lady in my station for lower limb examination, her dress was just so loose. If I had raised her leg, I would have opened her.
Okay, no, my station was a guy actually.
It was a lady, so I couldn't raise her leg because I don't want to risk exposing somebody.
Okay. So, and then the things I wish I did not do. I wish I did not kill myself within psychiatry, because I read psychiatry for that. And I read them, and I was so persistent with these things. So like, I was struggling with other units, but I was like, I have to go and touch short postings. What if there was this part of me saying, what if?
Short postings don't really come out like that.
Nothing.
Like
medicine.
In surgery.
Like how many percent would you say that short postings come out? Is it 20% or 10%?
In medicine,
she should not come out. Not even one. It was just in this thing. OSCE. Was it OSCE or OSPI? One of them. That one question was from dermatology. Yes. OSPI, yes. Dermatology.
Okay,
yes.
Okay, that's
yes.
called that herpes simplex.
Yes, herpes zoster. Yeah, herpes zoster. Yes, herpes zoster.
So how about surgery?
Surgery? Okay, no, the
surgery will ask from short postings. Like you see
ophthalmology, but then that ophthalmology really vexed me because
it's not what's that stuff again? Pterygium, right?
That was OSPI now.
Okay, you're talking about OSPI.
I'm saying in general,
okay,
like
surgery.
Surgery, but then the essay of that surgery was really, really annoying, because the short postings, this thing just
be one question, 6A, 6B, and
just clustered it in one place. I was just looking at it. I was like, see things that would have given me so much sweet marks, and then they're just clustering it to one question. Then they came and gave us things that were like, no, these things cannot come out. Intestinal obstruction. This one now. I'm telling you, I was not like, and this was in my jota. I was so close to revising it, and then I remember thyroid. I said, okay, thyroid will come out. Thyroid did not later come out. I was so pained.
You need to take AOCs, the pinch off. So
yes.
They didn't forget they told you that.
And then they just go and
do something else. Other times, it's also the HOD, because lecturers that did the stuff for you submit to the HOD. So the final question is the HOD's discretion.
Yes,
because he was not there when they told you that this will come out. So it just be like this and that. So it's not as if the lecturer had the mind to sly you or to do you bad, but it's just the HOD that does.
But it was very painful, Sha.
Of course.
I say that thyroid.
Last question for today is, what advice do you have for those who are yet to write the exam, so they can also pass the exam as well, just as you guys? So
okay, now we've been gisting, like we've been catching fun.
Yeah,
so this one is the ones we're talking about now has been subjective. Things I did, things she did, and things both of us did not do. But this one is objective, like things you really need to do to be successful. So one thing I think you have to prepare for the exam when you're doing the particular posting here, because in as much as you don't get to do all the postings, but anyone you are doing, you have to hold that one tight. So you know the one you're running helter skelter is the one you did not do. So I think that whenever you're doing a particular posting, there are things an undergraduate should know about the posting. For example, you can't be doing general surgery and you don't know about breast pathology, you don't know about intestinal obstruction and all of this. So there are things you are supposed to know.
It's very glaring.
And how to get in.
You
see the cases more exactly. So things, and there are things you see in clinic. or things they like from the lectures, right? So you need things you need to know. So for any particular post, you have to ask yourself, or even ask a registrar. Even if you don't, you can't reproduce, you can't produce this yourself. You can ask a senior, like a chief there, and be like, what are the things you think I need to know in this posting? They will write a list of topics for you. Go home and read. And by the time you're done, you see that when you come around and they ask questions, you flow very well, and it encourage you to even read more. So that's
So
that.
it's even more like if it was like used to do medicine and short yourself that we need to do, or even this unit or this I think we're doing short postings. I think it could even really help. What are the things I should know in this particular unit? I think it's very very important.
It helped me a lot because for any particular
so
posting,
you don't read unnecessary things.
exactly. So or I don't think anything is actually unnecessary,
I know,
but things that are not high
I know
yield.
high yield. That's the word, not
Exactly.
unnecessary. Yeah, thank
So
you.
yeah, and that's that, and also to I don't know, to share knowledge too, because something they'll say in your unit they'll not say in another person's unit. To avoid that number 21, the answer is they said it in my unit, and then they don't say they
That
said
is
it
so
in your own
annoying.
unit. So I think by the time you do this for all the postings you do, get a list of topics, things you're supposed to know. Like you're doing plastic surgery, nobody should tell you that you should know about skin grafts and flap and all these things. So things you need to really know in every posting. So by the time you do this, and then you have a documentary, because you know this is a posting that spans over a long time. Like I wrote the exam in 2020, so I started the posting in 2019, like 3 years. So you have to have a documentary. Your brain is not a machine. You can't reproduce everything. So have something that you
Writing
refer
things
to
down,
and everything.
yeah,
And
right.
that's very important. Also get involved in patient management. See, assign the patient, you follow that patient up till the very end, because the question will be like, what's the diagnosis, what investigations, what is the treatment. So by the time you have been involved in the management of patient, these things will not be any problem to you. So I think it's one at a time, every unit at a time. Anyone you are doing, try to make the best of it. Yeah, that's basically the advice.
Okay,
Okay, to add to what my colleague said, I think that also, even at the morning of that exam, you should listen to what people are saying around you. Open your ears, because sincerely helped me a lot, especially in my OSCE. I did not remember to revise history taken for liver pathology, hepatitis. So I was just listening, and someone beside me was talking about it, really rattling it, and I listened. And when I went in, I saw the question. I should take her history, and that was what I used to take, that history. So yes, so it really helped. So really listen. You don't know it all. You're not an island. So ask questions. Ask your neighbors.
they read though.
Yes, obviously.
Before you know they were asking the question.
No, obviously you have to read now, and then if you don't read, how would you be able to know what that person is, what the person is saying is correct or not? Exactly. So you have to know stuff. And I think there's something people usually miss, but I like saying it. It is very necessary to sleep a night before your exam. You see all these things that people say crash reading helps for some people though, but
I just know what works for you. I think that's the best
sometimes it doesn't really work fine.
Crash reading does not work in medicine and surgery.
It doesn't. You have to. You need to sleep, because sometimes you need to use things that you heard during postings, things that you saw somewhere. Yes. So you have to. So you really have to mop up so many things from your brain, and you're telling your brain to work really fast. But then when your brain is not calm and it has lacked sleep, you really wouldn't be able to reproduce so much. So you really need to sleep. Obviously you have to read.
To pray if you're a Christian.
Yes, I got factor. Let me CKD. That night I was feeling sleepy. I was like, let me just open CKD. And I opened it. I kept glancing at it, looking at it. Guy, my mind was just telling me doing this CKD, because they didn't when they did nephrology revision. Nobody mentioned CKD. It was just AKI. And I was struggling with the AKI. I really could not get so many things they were saying. So I just switched to CKD. I was just reading it. I was feeling sleepy, but I kept just pushing and reading it, only for me to come to it was it number 1 or number 2 question. I was CKD, so I was really shocked, and I was thankful to God, because waiting for do, and I did not do nephrology posting. So I mean, how would I have written? I wouldn't have been able. Even gastroenterology, I didn't do that posting. So how was I even able to write it? What she said in class was what I wrote. Yes, that was what I wrote. But I know bank.
Okay, so another thing I want to ask you guys, what do you think was a problem why most people actually failed in your class, the medicine?
Okay.
You guys know the
I
reason
think
why?
number 1, the timing.
Was too tight.
Yes, I think that we were just bombarded back to back. We did what's it called, mock this week. Then next week we started main. And then if you look at most people, we had FCs. Most people had FCs. So the OSCE that was supposed to be like something to cushion the OSCE was now like impromptu. So most people probably did not prepare so well.
So they were thinking that there would be time to.
Yes, now we're expecting OSCE and OSCE the next week.
Okay.
So we had like weekend, Friday, Saturday, Sunday, Monday to now prepare for it, but it then came impromptu. So
But I also heard this rumor that you guys annoyed your HOD or something. Is it HOD? Have you one man?
Is it?
Yeah, that's what also resulted in the whole.
I don't think so.
I don't think that's the case.
No, he's not that kind of person. He's not petty.
So it won't make people feel like.
No, not say one person doesn't have the power to make everybody feel. There's a board. This is discussed in a meeting, so you cannot just sit down and be like, no, I want this person to fail. This person must fail. And I mean, one person cannot come out for so many persons to fail. So it's not really possible for that person, that so-called person that was angry.
Yeah, because it was really, even people that had never really failed before really failed.
And
this
then
time.
also
really
probably
crazy.
maybe those people did not really understand
the dynamics of the exam. Because the exam is unlike every other exam you've written in this school.
So what's special about it?
What's special about it is that it comes a long way. You have to have come a long way.
And then you have to know how to understand like clinical knowledge.
Exactly,
you
because
have to put it into practice.
There's really nothing there's nothing called medicine is application of anatomy. Because when we do an examination, you are using anatomy.
Yes,
then there is physiology. Then there is of course not a lot of biochemistry though, but then pathology, of course. Pathology is the bedrock and then pharmacology for the management. So these are things you need to have. Like, for example, if you don't pass medicine, I don't even think it's because you did not read medicine. Maybe because you took some things for granted in your formative years.
Okay. Maybe you were just jonesing through.
Yeah, some things need to make a lot of sense to you before you get to apply them. That's why medicine is not the exam that you can easily sleep a night before a medicine exam and still write the exam well the next day. And you can easily kill yourself the night before and the exam will still be bad for you. You understand? So it's not something. Exactly. There's something you can place your hands on and that will come out. There's so many specialties they can decide to ask from anywhere. So you really need to have a wealth of knowledge for you to be able to pass the exam.
You cannot hold on fast to what you have. Like, how do I explain? You cannot say, okay, I've jacked nephrology.
Yeah, make I use that one. You know if you use one specialty,
because that specialty if you just fuck you up, you not go come out at all. You can't look like So it's really, really necessary to
and start preparing for the exam and then also people also take continuous assessments for granted. Your M1 matters. Everything is not the final exam. For you guys that are doing M1 to M4, your M1 test to M4, all of them will contribute. I think 40% is from CA. Showing you that the main exam is just 60%. By the time you've bottled 40% and you're having like 11/40, how you want to take pass?
In the grace of God.
Yes, you treat every exam like it's the final exam. If you've been getting 80s in your continuous assessments, you should be around like a 28/40. Do you understand?
Yes.
So by the time you can just get 30/60, just half to pass, just be minimal. So I think the exam comes a long way. So the preparation also comes a long way. So it's not a one night stuff.
Wow, I've learned a lot. Medicine and surgery. We wait for you. We wait. When I was writing message, I will just go to this video and just click on it and just sit down and be listening and just making the mistakes that I shouldn't make. I just, and be prepared no more because it's seriously, I was really scared. I was like, this is weird. Like, why is it fail? Like,
Like, I was the one that prepared the statistics as the academic committee chairman. Like, people that failed
really
medicine, we are like 68 that read the exam, 42 failed medicine.
Like, it was more than the pass.
It was so terrible. I'm also celebration.
Wow.
Yes,
seriously. I'm really happy for you guys. Congratulations again.
Thank you.
Yeah, my seniors, and congratulations.
Yeah, you're
welcome, my dear.
I remember when I was like,
get out.
I remember those years.
Rubbish. Anyways, thank you so much, you guys, for coming to my channel. Seriously, I think I need to do my channel.
I will remind you. I'm that petty. I will remind you.
No problem. I will actually. So thank you so much for coming to my channel. God bless you. And you guys, you've heard what they've said. Make sure you learn and make sure you don't make the mistakes they've made. Just be up and doing. And if you're yet to write the exam, or like people like me that are yet to, at least now you've seen the things you should take. Very important, okay, you guys. Even this thing, everything it doesn't only apply to medicine and surgery. Even every exam in medical school, actually, most of them is like this. Although I know every exam in medical school has different ways you have to pass it, but you guys, so this could really help. So please, thank you so much for watching to this very end. Please subscribe to my channel and don't forget to comment and share this to your friends that need the help of this video. Okay, see you guys next time. You guys say bye.
Bye.